Nicolle, Alexa, and I learned about epilepsy. So epilepsy is a neurological disorder. Approximately 1% of the U.S. has been diagnosed with it, which means about 200,000 new cases occur each year. It is considered a syndrome rather than a specific disease because epilepsy actually can occur within 50 different diseases. Some of the symptoms of epilepsy are recurrent episodes, which we would know as seizures, loss of consciousness, sensory disturbances, a blank stare, or temporary confusion while it's occurring. So to assess this, a lot of it depends on history. So you're going to want to ask your patient about their personal history, their family history, any past illnesses or surgeries, any major lifestyle changes, medications, past head injuries is a big one that you want to be watching for. You also want to ask them about the age of onset, the frequency, duration, and severity when these are occurring. You want to know what happens before the seizure. Do they feel dizzy, tired? Do they see flashing lights? And then what happens after the seizure, which you'll probably want to ask the family or somebody that witnessed it. For the physical examination, you want to check for any changes mentally, any cranial nerve function changes, changes in muscular tone, strength, things like that. Another thing that you want to look for is mouth or tongue injury. A lot of times people can tense up during seizures and bite their tongue or their cheek, cause injuries. You also want to be looking at the eyes, particularly during the seizure. And then just want to talk to the patient too about how a lot of times it can create psychosocial problems, because you never know when you'll have a seizure, so you can't drive usually, which causes a lot of issues, and it's just really embarrassing to the patient if they have a seizure out in public usually. So some of the causes are in the primary central nervous system. These can include things like strokes, tumors, abscesses, or aneurysms. It can also be caused by metabolic or systemic disorders such as overdose, drug withdrawal, hypoxia, hyperthermia, things like that, as well as idiopathic organs. So the diagnosis is ineffective airway clearance related to clonic tonic motor activity and tongue obstruction. So you really want to be watching out for the ABCs, airway, breathing, and circulation, because during a seizure you can't do anything to stop it, so you just want to make sure that they're still breathing all right and everything is functioning correctly. It takes usually 2 seizures without any reason behind them to be diagnosed with epilepsy. And then some things that can be used to reach the diagnosis are magnetic resonance imaging. This checks out the CNS for any changes in brain structures, so this would look for atrophy, brain tumors. And then electroencephalogram also measures the neurons, the patterns of electrical activity. As far as treatments, it can be treated through medications, which is the most common one used. Surgery is a lot more rare, but you can remove the area of your brain that's causing seizures. There's also some different therapies that you can do, such as the vagus nerve stimulation. This implants a device underneath the skin of your chest, and it actually sends electricity to your brain. You can also use a ketogenic diet. This is more commonly used in kids that haven't responded well to medications. They've seen in some studies that higher levels of ketones, which are when the body uses your fat for energy instead of carbohydrates, higher levels of those can decrease seizure activity. And then there's also the deep brain stimulation. So for prognosis, it kind of just depends on the patient. Some require lifelong treatments, others simply just outgrow them. That happens more if you get seizures as a child. Like I said, you want to teach the family and make sure that they are looking out for their airway and breathing while they're having a seizure. And then you also just want to educate their friends and family or anyone who might be around them in the event of a seizure on what to do in that situation. So you would tell them to lower the patient to the floor, place something soft under their head to prevent injury. Try to maintain the array if possible, but a lot of times people will clench their teeth, so in that case, just leave them alone. And then try to clear the area of anything hazardous, sharp, or hard that they might hit themselves on. And don't try to restrain their movement.